Okay, welcome then to this session, this 45-minute session, which introduces Health Business Elite. So to help you search and stay informed with the literature that's available through this particular database. So Health Business Elite features comprehensive journal content, including full text access to the Harvard Business Review, and details all aspects of healthcare administration and other non-clinical aspects of healthcare management. So for those who've not met me or attended one of my sessions before, I'm Richard Crooks. I work with the EBSCO Customer Training Services team. I'm based here in the East Midlands in England. So I currently support library services essentially and possibly end users from time to time in the UK, Ireland and the Nordics. So welcome to the session this morning. So in terms of the objectives for this webinar, I hope that by the end of this session, you'll be able to perform a natural language search to find full text articles. You'll also be able to combine searches for more in-depth searching. You will also be able to save, share and download search results, browse and search within specific journals, and also set up search alerts as well as journal alerts to keep up to date with what's out there in terms of healthcare management and related subject areas. So I hope that's what you're expecting from the session this morning. So just to give you an overview then initially of this database, so you'll have access to more than 600 full text journals and magazines, of which more than 280 are active full text, so that you can access the current literature there full text. And you see the kind of subject ranges or subject range of topics that are available: computer technology, facilities management, hospital administration, hospital management, human resources, and so on. So just to give you an idea of some of the key titles that are indexed and are accessible full text. So these are ongoing full text journal publications with no embargoes. You have access to the latest content for these journals, such as the Academy of Management Journal, the Academy of Management Review, the Academy of Management Perspectives, and so on. And some more here, including Forbes there, and also, crucially, Harvard Business Review, which we know is very important and even popular with senior management within healthcare. Some more here also, Healthcare Financial Management, as you can see there, Healthcare Executive, also the Journal of Business Continuity and Continuity and Emergency Planning Journal. So again, these are all ongoing current full text with no embargo. And some more here as well, and again, some you may recognize, such as the Journal of Business Ethics, Journal of Healthcare Compliance there, Journal of Human Resources, and just a few more here, including Modern Healthcare, again, popular title, and also Nursing Economics as well. And then finally, we also have PC World, for those who are interested in computing, and also Pulse there as well. So again, these are all available, ongoing full text with no embargo, accessible through Health Business Elite. Okay, so if you do want more information specifically on the remaining journals or publications that are included, we do have the EBSCO.com website, so you can access that anytime, and that will give you an up-to-date listing of the journals that are indexed and also the subject coverage as well, and other content types as well. So you can either view them online through HTML or download the Excel spreadsheet to review offline. So especially if you're considering this as a potential subscription, you may want to review that content. So that's just for information purposes. So what I'm going to do is go to the live demonstration and just run some sample searches so you get a feel as to the kind of look and feel of the database itself, which is, again, we're looking at the native EBSCOhost interface. So I'm just going to make sure I'm on the right screen here before I share. So you can see here we've got the Health Business Elite database. So very similar to what you would find when you look at Cinel Medline. It's using the same EBSCOhost platform. This is a new interface, of course, so those who perhaps in the HSC or NHS have not yet migrated to this, but this will be something which you'll be switching to this summer. And we have the multiple rows for entering search terms. We also have the ability to add more rows if needed, up to 12 in fact. With also the drop-down menus if you want to do more detailed in-depth searching. And we have the initial filters on this page as well, including publication type there, as you see, the publication date, and also the current search options. So you can see for a basic search, we're using the proximity search mode. If you want more information on these search modes, including natural language search, which we'll explore in a moment, we have the EBSCO Connect Context Sensitive Help menu. So again, this gives you a detailed description of each of the search modes, what they're doing, etc. Likewise, if you look at the expanders, this one is on currently, which is the Apply Subjects Expander, which will map your keyword search term, your free text search term, to a particular concept, which in turn will then identify the relevant subject terms from the index. So again, you can explore EBSCO Connect for more detailed information about each of those expanders and how you might apply them to broaden your search on this interface. Publications are also indicated here, so you get the alpha menu there. You can search directly for publications or browse, and you can see the amount of full text content that's available. So some of these publications are either available in HTML full text or PDF or both. So before going any further, then let's just run a search. What I will do here is use the natural language search initially. You can set it up to use it from the advanced search page when you can select natural language search here. I personally prefer to go to basic search and use it from this screen. So if you switch natural language search on there, you can then enter a statement or question that you need to have, that you're looking to retrieve relevant articles for. So in this instance, I'm just going to ask this question of the database. So what is the impact of Gen AI on the healthcare workforce? So again, it's kind of healthcare management related. And I'm going to so enter it as a question or statement, click search, and then you'll notice the results will appear below. So you'll see a few things here to point out. Again, some of you may have seen this demoed in other databases like Synon Medline or even on the Discovery service. But you can see here we've got a couple of links that are important. So for any end users, that could include senior managers, there's this little link here to just remind you how it's working. So basically, a large language model is prompted to create a Boolean query, which we'll see in a moment, to run a search against your question or statement. So again, it's constructing the query behind the scenes and rerunning that, and we can see what that will be shortly. Okay, and there's some examples of the kind of questions that users may ask, although these may be more of an academic nature, as it were. Then there is the show refined query option. So that details the actual Boolean query that's been created by the large language model. So you can see here, not only have we got Gen AI there, we've got generative AI or artificial intelligence or machine learning now. So it's brought in the search to include those elements combined with the Boolean operators, of course. Healthcare workforce could also be healthcare workers or medical professionals or clinical staff. And it's also got the impact, which I put impact in the question, but it's also put effect, influence, or consequence. So it's constructed that query and run it on the HealthBusiness database. Now, there's an additional option as well, which would not be enabled by default, but can be. This is like a recommended query. So it's also saying you may also ask, how is generative AI transforming the roles and responsibilities of healthcare professionals? In what ways is AI impacting the efficiency and job satisfaction of healthcare workers? So you could click through to any one of these and review the results from that. So if I click one of these now, so I've got the results below, as you can see here, these references already listed there. Then if I want to click through, I can see this would run against the database, and unfortunately that one doesn't bring any results back. So again, this is a relatively new feature. If I go to recent activity, I'll just go back and let's see this one. This was what I ran earlier. So this is the question that I asked, and these are the results below, as you can see there. So again, now what you can do is also, you can refine the search as well. So again, you can apply filters as well. So for example, we've only got 16 references, but if you wanted any full text particularly, then you would click full text here, and you see 13 other references are full text, etc. And then if you want to go further and specify a particular time frame, for example, we want to look at the last 4 years, particularly, dates here, you can do that here. So now, unlike before where you had to enter, for example, date range, custom date range, you had to enter the day, month, and year. You can now specify the month or the year itself. So I can just put in the year here. So since ChatGPT made an appearance from 2020 onwards publicly, then we'll put 2022 and then up to the current time, 2026. So typically when you enter the from date, it's from January of that year, and it will default to December of the year the year-end date. So 2026 will be December, even though we're only in April now. So we've got 8 results, okay, full text articles that have been published since 2022. And you can see here, this one's from Healthcare. This is on Health Marketing Quarterly. You can see in Health Affairs, etc. So you can see these references here. Okay, so just an indication of how you can use natural language search to generate a subset of results that are relevant to the query, and also how to filter using the quick filters to full text only, as well as the date range. Again, that feature was released a few weeks ago, as it were. Now, of course, you may want to go a bit more in depth, a bit further. You may want to dig a bit deeper than this, rather than just doing a simple keyword search or a natural language search. Then you can, if I click new search here, go back to the initial search screen and make use of these rows. Now, if we look at a topic such as staff shortages, etc., within healthcare, then what I can do, I can start typing or entering my terms here. So if I put staff shortage, or I can combine that with absenteeism, and I can, instead of just absenteeism, etc., I could truncate that to find those variations, those alternative expressions as well. So use the asterisk as the truncation symbol. I can then explore this in relation to the healthcare, into healthcare or possibly nursing. Again, I could truncate, so that could be nurse, nursing, or nurses, etc. And then I could also, in double quotation marks, put in allied health. So again, I appreciate that for senior managers, they may not enter the search this way. If you're doing it for them as a librarian, then you may well be creating a much more detailed search for them on their behalf. But again, this is just to show some of the highlight some of the functionality of searching here. And then we're using the Boolean and to combine. I'm not applying any fill codes here at this moment in time. You see we do have title abstract searching possible in Health Business Elite, by the way, and there's also a geographic terms option, GE fill code for specifying a particular region. So when I focus, you can do that. Now, at this stage, you can still apply filters if you wish. We won't do that right now. Maybe perhaps we will for the past 5 years. So we'll leave that with 5 years here. So we are going to filter immediately for records published in the last 5 years, but I'll show how to apply the other filters too. So I click search here. Okay, so I've got results below. Okay, as you can see here. And what I'm going to do now is simply just add, and what I can also do, actually, one thing I can do, you see the search history below here. That's probably going to show lots of other searches which will be running today, but you can amend the search string here. So if I go to the tools menu and click edit search details, I can go in and edit the search. What I want to do is also add or medical or medicine. So again, I can add this term, truncate it. So let me just truncate them more accurately here. So that could be medical or medicine or medics or medic. So I can add this element to the search, update it. So I'll try one more time, but let me try here. I don't know what's done that. Maybe because I'm combining the two. I know there's a feature to be able to edit multiple, when you combine search queries. So I think this is where at the moment you cannot currently do that. So what I might do here, just cancel that for now. Okay, cancel that, come out of that. And what I would do is just stick to this result set for now. Okay, or what I could do actually, let me just go in. Let me delete that. Okay, I'll delete this now. And I'm going to redo this query. And this time I include medic. So let me do staff shortage. Okay, or absenteeism. So that's absence or absenteeism. And then healthcare. And since healthcare could be 2 words, I could put healthcare here as well. That's 2 words. Or nurse, I'm not going to truncate that. Or allied health. Or medic, let's do medic first. Okay, or allied health. Okay, so I'm going to use all those elements. So click search here, and we'll apply the publication date in a moment. Okay, so I'm going to hide the search history for now. So we've got over 5,000. I'll include the extra element of medic. I've not yet refined my publication date. I can do that either from the drop-down menu on this page, or I can go to all filters and select publication date here. So I go to the past 5 years. I will also select from the subject index terms as well. So I'm going to refine this search by the subject matter, the subject index terms. So if I select the arrow here, you can see it gives me the hit count. Also, United Kingdom's featured here, which is crucial. So what I'm going to do here is I'm going to resort these, and then I'll go through some of these. So let's see, as we scroll down, I've got, for example, I'm more interested in the geographic location, essentially, but I'll use the subject areas here. So we've got England here. We've got Great Britain National Health Service. This is really specific, what we're looking for. And I will also choose now by United Kingdom or its National Health Service. I can include that too. Those may be relevant. And then also we've got United Kingdom as well. So I'm going to choose those and update the selection. So now I'm going to apply these subjects to the search. So I'm going to retrieve results. So we're down to 75 records from about 5,000 or so. So again, really quick way to narrow. You can see here the very first result is published in Nursing Management. It's a recent edition in February, volume 33, issue 1. So you can see the citation data is now included here. So we've got that article. The next one is the Journal of Health Services Research and Policy. Again, you see where it's the UK here, etc. And also, if you look at the subject fields, you'll see United Kingdom highlighted there, or National Health Services, etc., and so on. Again, you can see the UK National Health Service. So understanding why health professionals are leaving the UK National Health Service. This happens to be a sister review, which is published this month. So again, this is very current information that's available from this list here. So again, I could filter a bit more. I could even go to the source type here, or from all filters, I can go to source types again, and this time select the academic journals and click apply. So now down to looking at academic journal literature that's available and been published in the last 5 years. So 47 references. Again, still the same top reference there and others that we saw earlier. Okay. So we've got those results, etc. And now, of course, once you've got those, we may be exploring further. So, for example, if you want to look at an article, you'll see, so for example, item 1 is not full text, but we do have this more like this feature, which if you click on that button, it will give you other related articles which may be of interest. So again, this one happens to be available in full text. Okay, and you can read the abstract, you can read the full description, look at the subjects mentioned, and you see this note about this recommendation. So basically, you're exploring related research through the unique metadata base that EBSCO has access to. Okay, so typically it gives you 5 additional articles to review, and these may well be relevant to your search, etc. And of course, you can comment whether the recommendation was helpful or otherwise. So again, you have those options available. Okay, so you can select those if you need to. We have also the cited by count as well. You can see this is cited by 3 articles, etc. You might find some with more. Obviously, the more, this one has 14, by the way. So again, this is published in 2021. So you could check the cited by count here, which articles have cited this article, and you can see the listing of them. And also you can sort them by the most recent as well, published, the date newest, and also determine which of these are available full text. Okay, so these are now full text articles, and you can also see where they're coming from. So these are Sinner Complete, Medline Complete, and if you want to see if any are in this database, just click on that link. It happens to be that they're not actually, but it basically does give you access to those references. Okay, and if you subscribe to those other databases, you may well see them and have access to them, and you can go in and select them as needed there, as you see. Okay, so we've got those elements available too. We've also got, of course, the access options as well. So again, we stick to this one for now. Access PDF. You can view the PDF content here. This gives you the native article, and you can see that here in color, as it were. So you can view that online, or you can go through the process of saving, use the bookmark icon. You can generate the citation through the cite tool. So we've got Harvard referencing currently selected, and you can copy that to the clipboard. You can also select an alternative style too. And also you have the export citation. So want to export this in RIS format or for RefWorks EndNote, you can do so from here. Now you can also share this article. There's the arrow there. So with the share option, you can share via Google Drive, OneDrive, or if you just want to simply create the link and copy that, you can. And then there's the email option. Now the email option has been enhanced. It includes the PDF as an attachment. So you'll send in the metadata, the citation information, plus the full text. And in addition to that now, you have the preferred display. So by default, it's the brief citation. You can include the abstract if you wish as well. Or alternatively, you can opt for the detailed citation, which allows you to specify which fields you want to include when sharing or emailing this. So it could include the abstract, plus there are other fields, for example, language, ISBN, or ISSN here as well, or PubMed ID, and you can send that information. Okay, so you could do that. Okay, so that's a new feature with the additional options for sharing a citation. You can also download this article too. You can download the PDF or simply the metadata if you prefer with the Word option as well. So you can just download this, and then when it's available, I can open this up to show you can see what it looks like, and I'll just drag this across. So this is the Word download for this article, and it includes the link there as well. Okay, so that's available for the download tool. You can print, of course, so any of these articles you can print here and just follow the same prompts as you would normally. There's also publication contents. You can view other articles in the same journal issue. And we have the text-to-speech software, so you can listen to this being read. This is a new feature for PDF content for the new interface. So again, you can play this, you can download the MP3 as well if you wish. And then finally, we have accessibility support as well to enhance users' use for an alternative format. So you can see while PDF is available, HTML is not by default. You can request the HTML article, or if you prefer, in Word, so you can enter your email address. Now, there is a note to say that this remediated content is typically available within 3 to 5 business days. There'll be a slight delay in you obtaining that format, but you can request it for accessibility purposes. Now that's the PDF, of course. We'll just quickly move on to the next one. So where you see access options, it will give you more than one. So again, online full text available here, and you can view that online. Again, you can bookmark it and save it. The site tools there. I'll come to add to project in a moment. But we do have the translation option. So obviously this is in English. You can translate into another language. So for example, Danish, then you can do that. Or if you prefer, you can even do Welsh. So let's go to Welsh here. So we can now translate this from English to Welsh, which is obviously very useful for institutions in Wales, as you see there. And of course, if you're a native Welsh speaker, then you can verify the accuracy of that language, and you can revert back to the original language as well. Okay, so that translation is provided by machine translation provided by Microsoft, as you see there with the annotation. Okay, so those features are available for online full text. So that's the full text content, of course. Now, obviously, besides looking at the full text content, you may want to just process these records or save these results. So you can do that in a number of different ways. You can select these results. So you can select up to 50 and then bookmark them, and then they are saved under the save folder within the dashboard. So they will be appearing very soon. Okay, so now, since I'm not signed into my EBSCO account, these only save for the duration. So I've got 49 records saved so far. I can review this list. I can go in and delete items if not appropriate. So I can go in, or not here, sorry, in the other page. It can download the list as well. Again, choice of formats, including BibText. I can also export from here as well. So RIS format, RefWorks, and so on. And I can also as I said, sharing a project. So a project folder is basically your personal folder that you create yourself, where you can collate references, especially if you're working on a particular search, you're supporting a particular manager, for example, you're collating information for them. Then if you click add to project here, then you would sign in to EBSCO to do this. So I'm going to sign in here. If you don't have an account, you create an account here, add your first name, last name is optional, email address, create the password based on the criteria below, or including that, or being aware of it, and then agree to the consent form and create, and so on. And otherwise, sign in here. And then once I'm signed in, then you can choose a project or create a new one. So I create a new one here. So this is on, let's see, this is on staff shortages and yeah, and absenteeism. Okay. If I have a deadline to get this information to a particular person, professional, management, etc., then I can specify a deadline here. So I'll put 1st of May. I can add a description, maybe who it's for, etc. And I create this project. And then if I go to my projects folder on the left-hand column, you'll see I have this particular project with the records now saved there. So you can see there again. And then this is where you can screen these, you can edit these, you can go in and remove certain articles that you may not think are relevant. So you can delete these if you need to. And it also allows you to bulk delete as well. Okay, so you can go in and select them all if you wish and delete them. Now, if I go back to the search, make sure we're moving on here. Again, from the results list, you can actually, apart from downloading and saving, you can actually save them ultimately to the project directly from this page. You don't need to save them to the save folder and then save them to a project. You can do it directly from here. Okay, as you see there. And then the share option is there again, so you can share these 47 records. And then again, when you email, you have the choice of the citation format, or you can choose the reference style and send accordingly with the abstract included. So again, you have a number of different options there to process these records. Now you can, of course, also save individual records. You use the tools menu and you'll see the option to cite, add to the project, share and download is available from each of these tools menus. Likewise, if you go into an article and view the detailed record, you'll see the same tools are also available here. Now on this page as well, you have additional information, as well as getting to the full text and downloading. You also have the list of references. Okay, so you can explore those as well. You can also limit to those that are full text, as well as those that are in this database. You can check the cited by articles, more like this. So again, the recommendations, and then more the publication contents itself. So again, you've got different options within the detailed record page, additional options to explore the references and also the other articles in the same journal issue, as it were, if you need to explore those. Okay, so again, those are available too from there. Okay, so let's see. Let me just check here what we're going to do now. So what I might do now is switch just briefly. So that's kind of processing the records. And of course, we do also have the option to create an alert as well. So I just do this for the search alert, and then we'll do the browsing the journals in a moment. So if I want to be alerted to new content for this article, then I would just simply go into the tools menu. I can create the alert here. So again, I need to be signed into my EBSCO account for that. So I'm going to clear this. So it defaults to the search string, and then add the name, the alert name, something recognizable. Okay, add a description. Maybe again, it could be done on behalf of the senior manager, for example. Then you've got the frequency. By default, it's daily. It could be weekly or monthly, so I'll choose weekly. And then this alert will be valid for 1 year. So it expire on the same date in 2027. Okay, now obviously you can come in and delete that, as I'll show you. So if I create the alert now, that is my search alert created, and it's available in the alerts menu under my dashboard, and you'll see search alerts and then this one. So this is not yet run. I had this one on eating disorders, which is one last run a couple of days ago. So you can go in and edit the alert, So if you want to change the frequency to monthly, you can do so here. If it's due to expire, and normally you're warned 30 days before it's due to expire, you can extend or renew the alert. Okay, and save changes. Now, the other thing you can do, as I mentioned, you can also delete it. So this one, for example, I no longer require. Go in, delete, you get confirmation on screen, and then delete if appropriate. Okay, so that could be something you can set up on behalf of a manager. If you want to be proactive, you can set this as a current awareness tool to inform them of the latest information in relation to key topics. So again, it could be quite basic, it could be quite a standard search, or it could be more in depth. Now, there are journal alerts too. You must have seen that when we came into this page. So I got one for Psychology Today. Now, if you want to set up a journal alert, then go to Publications Authority, and this will allow you to search or browse for publications. So if I search for Harvard Business Review, it takes me to this page. You'll see HTML full text and PDF is available for this journal. So it's a ongoing full text, non-embargo title, so you'll get the latest information. You can, of course, browse the issues and articles by clicking on the corresponding year and issue, and those will appear in the result list. You can also search within the journal itself. So, for example, if I look at organizational change, then I can search within the publication as well. So you can see here, these are now results appearing in the Harvard Business Review in relation to organizational change. Okay, you can see it highlighted there, or within the subject fields or the abstract. So if I go back to Publication Authority, so if I wanted to set an alert, for example, for this journal, then again, go into the page, go to the Tools menu, and you'll see we've got Create Alert, defaults to the publication title, and then you can set this up, and then you see the reference to managing your alerts from the alert section within my dashboard. So click close here, and then you'll see under alerts, I now have a subsequent or new alert for Harvard Business Review. So now 2 alerts that are related to the latest content for journals. So basically, you'll be notified in your inbox of the latest content for these journals. So I'm going to go in again. You can go in and edit, or you can delete here. Okay. So again, you may set up numerous journal alerts for key healthcare managers, professionals within your trust or organization, and so they will receive that information. Obviously, you get a consent for that, but they will be updated with the new content from literature. Okay, so let me go back to new search here. I'm going to double check if there's anything else I've missed here that I need to cover. I think I've covered pretty much everything I planned to. So this is a 45-minute session. So let me go to the help menu. So if we go to help here, this will give you the direct link currently to the new EBSCOhost interface. So we are using the interface. I know some of you have not switched to this yet. So this is still being developed as I speak, but this will give you the FAQs page for ask questions, plus also information on basic advanced searching, applying search filters, applying expanders, etc. You can see there searching, creating a personal account, using the dashboard, for example. That'll give you an overview with screenshots of the different elements of the dashboard as well. So again, this is a really useful guide because it does give you current information on how you might use these features. Okay, so that's the help guide there. Okay, so what I'm going to do here is just stop sharing. I'm going to go back to my PowerPoint. So we had the live demonstration, and we do have additional support materials for this. So if you have a current subscription to Health Business Elite, you want to promote this, raise awareness, we do have this useful handout here. You can either scan the QR code or click on the link when you have the slide deck, but that is available, so that's free. You can download that and obviously print those, etc., and circulate those accordingly. And also we have the takeaway guide as well. So the takeaway guide is a trifold leaflet basically, which is really useful for users if you have a subscription to this, or if you're thinking about getting this and you do, then obviously you can circulate this. You don't need to create your own guide there. It's available for you. So again, the QR code there will just open up the relevant page where you can download this trifold leaflet, okay, and use accordingly. So it gives you an overview of the page itself and the different elements, etc. Now, we offer obviously further information available through the Healthcare Training Resources portal. So again, We have recordings available through our EBSCO UK YouTube channel. So the training videos will link to that page. Training sessions for obviously currently in April, and more will be added for May in due course. Again, there's a link there to the list of current trainings, and also support information will give you again access to the things like the handouts you saw today. So another relevant information. Otherwise, you have the standard support site, EBSCO Connect, connect.ebsco.com, which gives you additional links to tutorials, especially if you're new to the EBSCOhost interface, especially with its recent developments. So again, there's plenty of information available there and other support materials available. And also there's a link to EBSCO Academy as well. So the learning link there on the top toolbar will take you to EBSCO Academy. So our e-learning platform, as it were, and there are additional videos, recordings that may be relevant to this session, and also EBSCOhost in general. And there's also e-learning courses that you can sign up for, and also there's a reference to additional instructor-led courses sessions that can be accessed by yourself. Some of these may be in other territories which are also English speaking, which may be of interest as well. Okay, so I'm going to stop here, and by the way, you can contact me at arquicksebsco.com as you see it on screen.